Hello scholars, my name is Dr. Karis Dillon, and the goal of this channel is to make academic subjects easier to understand. In the last video, we covered schizophrenia. In this video, we're going to look at schizoaffective disorder, so let's begin. In order to be diagnosed with schizoaffective disorder, the individual has to have the following symptoms. Number one, the individual must fit the criteria for schizophrenia, but they also have to have a significant mood episode that is either a manic episode or major depression. So what that means is they'll fit all the criteria for schizophrenia. They'll have the hallucinations or delusions or the disorganized speech, but along with that, they're going to have major depression for a significant portion of the illness, or they'll have a manic episode, which is kind of a piece of bipolar disorder, that they'll get the manic episode, but they'll also have the major depression of bipolar along with that. So number two, the delusions or hallucinations must take place for at least 2 or more weeks without the major mood episode. So we have to know that the delusions or hallucinations are present without the mood disorder, to be able to know that they do have the criteria for schizophrenia at least. 3, when the major mood episode arises, it will be present for a large portion of the illness. So what that means is that you're going to look at the active phases of schizophrenia for the individual. And with schizoaffective disorder, we know that they have a mood disorder like major depression for a majority of their psychosis, which makes it schizoaffective disorder and not just schizophrenia. So this mood disorder will be present during the active phases of schizophrenia and in the remissive stages as well. Number 4, the depressive mood does not take place because of drug use or abuse, the use of a medication that might bring that on, or because of a medical illness. Now, when you're diagnosing someone, you want to specify whether the schizoaffective disorder is the bipolar type, which means the individual has had a manic episode during their illness. Please know that when a manic episode appears, there might also be major depressive symptoms that come along with this. And if you need more understanding about bipolar, we'll be putting out a video soon given that. And then you'll want to specify if it's bipolar type or if it's depressive type. So depressive type just has the major depressive episodes. They're not going to have those manic ups where they're up all day or they're doing shopping or they're... You'll also want to specify if the individual has catatonia. What that means is they either have a stupor or where they're staring for quite a few minutes to maybe hours. They might have a rigid posture. They might have their extremities might be in strange body positions. You'll also want to specify the severity of the symptoms as well. So with the severity, there is a quantitative assessment. There's kind of a test that rates the 5 symptoms of psychosis, which are the delusions, the hallucinations, disorganized speech, abnormal psychomotor behavior, and negative symptoms. So you want to rate each of those, and they have a 5-point scale from 0 to 5, 0 being not present, and all the way up to 4 to 5, which is present and severe. So you want to look at the most severe symptoms in the last 5 days is the way that they kind of address that. When the individual is assessed and diagnosed, it's important to look at the periods of life when the illness went uninterrupted. So you really want to look at the beginning all the way through those active episodes. These will be known as the active stages of the disorder. These active stages will tell us whether the diagnosis of schizophrenia have been met. That's kind of the first big step, is to see if this is schizophrenia. Then we'll look at if there is a major mood episode present during a majority of the illness. And if there is, this is when we diagnose it with schizoaffective disorder. These episodes of major depression or the bipolar type will be present for a majority of the illness. If a mood episode does not exist for a majority of the illness, then the diagnosis is schizophrenia. It is important for the diagnostician to address the psychosis, again, from the beginning till the end, to see if there is a mood disorder throughout a majority of the illness. An individual with schizoaffective disorder will have significant problems with academics or with working a job. They'll usually have trouble with self-care as well as trouble with different relationships. Sometimes negative symptoms, which can mean sometimes they'll have apathy or not care about a situation, or they don't have motivation to kind of get things done or do things, will be less severe in schizoaffective disorder as compared to schizophrenia. Now, those with schizoaffective disorder may have more trouble with understanding various social situations or events. They may have trouble with figuring out what's happening in a situation and why it may be happening. There are currently no tests that can help diagnosticians to label an individual with schizoaffective disorder, and we don't have enough studies that tell us whether there's significant differences in the brain or with cognitive issues when we're looking at schizophrenia versus schizoaffective disorder. These are things we definitely need more research on. Schizoaffective disorder takes place in about 0.3% of the population. It's more commonly diagnosed in women as compared to men. This is because the prevalence of mood disorders seems to take place in women more often than it does in men. Now, schizoaffective disorder only appears 1/3 of the time that schizophrenia appears. Schizoaffective disorder tends to appear when a person is in early adulthood, but it can definitely appear in adolescence all the way up till later in life. It's just more uncommon for that to take place. When it comes to the overall well-being of those with the disorder, those diagnosed with schizoaffective disorder tend to do better in the long term than those that are diagnosed with schizophrenia. But the mood disorder tends to be more problematic given the long term. It is important to note that manic symptoms or depressive symptoms can appear before, during, or after acute psychotic episodes. An individual who has first-degree relatives who have schizoaffective disorder have a higher risk of developing schizoaffective disorder. Individuals that have first-degree relatives with schizophrenia or bipolar disorder may also have an increased risk of developing schizoaffective disorder. One important statistic that needs to be noted is the risk of suicide given individuals with schizoaffective disorder. Currently, 5% of those with this disorder die by suicide. Continual monitoring of these individuals is important to make sure they are not suicidal. Persons with schizoaffective disorder sometimes suffer from anxiety disorders as well as substance use disorders, as they may try to self-medicate their own condition. Now, given all these issues, the lifespan for someone with schizoaffective disorder is not as long as those individuals that do not have the disorder. All right, well, that is the end of the video. Thank you very much. If you stay this long watching it, that's fantastic. I hope that you have an amazing day, and I will keep trying to put out these videos, as quickly as I can. Thank you so much. Bye-bye.